Invoking blessings of the Almighty, distinguished guests and elders, ladies and gentlemen, namaste and a very good morning. Welcome to the inaugural session of the Symposium on Genomics and Immunotherapy presented by Sri Madhusudan Sai Institute of Medical Sciences and Research. At the outset, a hearty welcome to the dignitaries on the dais. Our chief guest, Padma Bhushan awardee, Professor T. Ramasamy, former Secretary to the Government of India in the Department of Science and Technology. A hearty welcome to you, sir. Dr. Ayyappan, former Chairman and Managing Director of HLL Lifecare Limited. Dr. C.N. Ramchand, Co-founder and Chief Scientific Officer of Mac Genome Labs. Dr. B.N. Narsamurthy, Chairman, Prashanti Balmandira Trust. Our revered founder and CEO, Sadhguru Sri Madhusudan Sai. We invite all dignitaries to please come forward and light the lamp, symbolizing an auspicious commencement of the program. We will begin the proceedings with invocation by boys students of Sri Sathya Sai University for Human Excellence. They will chant verses from the Sannyasa Suktam.
तत्रापि दह्रं गगनं विशोकस्तस्मिन् यदन्तस्तदुपासितव्यम् यो वेदादो स्वरः प्रोक्तो वेदान्ते च प्रतिष्ठितः तस्य प्रकृतिलीनस्य यः परस्य महेश्वरः ॐ शान्ति शान्ति शान्तिः हरिः ॐ तत्सत् श्री साईश्वरार्पणमस्तु
The One World, One Family mission focuses on making a difference in the lives of our fellow men through service programs in the verticals of nutrition, education, healthcare, and social care. Spearheaded by Sadhguru Sri Madhusudan Sai, the mission over the last 10 years has embraced people beyond barriers of caste and creed, region and religion, gender and geography. Today, it has expanded to over 100 countries, and we have a brief video showcasing the impact of this global mission. The video, please.
One world, one family is the ethos at the heart of our mission. This ideal comes from an ancient Indian principle which considers the whole world as one global family. And as a family, we believe all our family members deserve care and support. Across the globe, we serve millions through 3 pillars: nutrition, education, and healthcare, all completely free of charge. The Annapurna Morning Nutrition Program began in 2012, providing breakfast for just 50 children, and has since grown to become India's largest morning nutrition program. Today, millions of school children across India and beyond receive the Sai Shore multi-nutrient supplement, helping them begin each day nourished and ready to learn. At our mission, we believe education is every human being's birthright. With a global presence and multiple campuses throughout India, we provide free education from grade 6 to doctorate studies, ensuring every student receives a well-rounded, values-based education that combines high-quality academics with moral and spiritual values. The Sri Sathya Sai University for Human Excellence opens doors previously unimaginable to children from underserved communities. By offering quality higher education to those traditionally overlooked, and with a strong emphasis on empowering women, we're breaking the cycle of educational disparity and promoting gender equality in education. Meanwhile, our Skill Development Center equips rural youth with job-ready skills, and our scholarship program supports education with thousands of rural children. Our commitment to empowerment is also demonstrated by People Shores, an impact sourcing organization in the United States. We help youth from marginalized communities gain skills for the digital economy. This innovative model delivers high-valued business services while transforming lives and uplifting communities. Our vision for accessible medical education became a reality in 2023 when Prime Minister Shri Narendra Modi inaugurated the Shri Madhusudan Sai Institute of Medical Sciences and Research, India's first free, private, rural medical college. This institution aims to nurture noble-minded healthcare professionals who are dedicated to serving the underserved members of our society. Our healthcare mission goes beyond treating illness. We're pioneering solutions to bridge critical gaps in accessible medical care, and through our network of wellness centers, mobile hospitals, and multi-specialty facilities, we bring free healthcare directly to underserved rural communities. From preventative care to complex surgeries, at our hospitals, there are no billing counters. Since 2016, we've expanded beyond India to serve communities across the globe with the singular goal of leaving no person behind. Exemplifying this idea, our Sri Sathya Sai Sanjeevani centers form the world's largest chain of free pediatric cardiac hospitals, giving new life to children with heart defects. And with continually growing needs worldwide, we're expanding our healthcare facilities with the world's largest free hospital. Our 600-bed facility that demonstrates our dedication to accessible healthcare for all. Our vision is clear. A society where life's value is measured not in wealth, but in compassionate service to those in need. And this vision only becomes a reality with the contribution and generous support of our global family. After all, we are all one world, one family.
Since the concept of genes fascinated Gregor Mendel to conduct his experiments and studies in the 19th century, genomics has today become a specialized science enabling marvelous advancements over the last 200 years. By providing deep insights into an organism's complete genetic makeup, healthcare in particular has been immensely impacted with better understanding of diseases, leading to better diagnosis and prevention, developing personalized medicine, control of infectious diseases, among others. The alarming rise in the incidence of non-communicable diseases such as diabetes, cancer, and coronary heart disease, all with supposed genetic predisposition, require solutions also at the genetic level. The Symposium is a curtain-raiser event towards establishing a world-class genomics center here at Sathya Grama. This underlines its relevance and impact, especially for an institution such as ours that is committed to embracing and furthering advancements in healthcare. The vision is to build a cost-efficient, end-to-end translational facility to discover, develop, manufacture, and clinically evaluate modern immunotherapies for patients, prioritizing affordability and regulatory speed. This includes development of antibody therapeutics, vaccines, cell and gene therapies, among others. Dr. Karthik Ramesh, National Co-Director and Principal Board Member, International Federation of Investors Association Bharat, will deliver the welcome address. He is also the Group Chief Growth Officer at TABI. Dr. Karthik, please.
Sairam. Sarve bhavantu sukhinah. Sarve santu niramayaha. Sarve bhadrani pashyantu. Ma kaschit dukhabhag bhavet. May all be happy. May all be free from illness. May all see what is auspicious. And may no one suffer any sorrow. With profound reverence and deepest salutations to the founder CEO of Sri Madhusudan Sai Institute of Medical Science and Research, Sadhguru Sri Dr. Madhusudan Sai ji, I welcome you all, wishing you a very happy Navaratri Eve. I also take this opportunity to welcome with great honor the esteemed dignitaries on the dais, starting with scientific luminaries such as Padma Bhushan Professor T. Ramaswamy, former Secretary of the Department of Science and Technology, respected Dr. M. Ayyappan, former Chairman and Managing Director of HLL Lifecare, Dr. C. N. Ramchand, a renowned scientist and entrepreneur in genomics, and respected Narasimurthy Sir, the Chief Mentor of the Global Humanitarian Mission. We also extend sincere gratitude to all our international delegates, scientists, policymakers, thousands across the world watching this scientific symposium live, and the entire medical community of Sri Madhusudan Sai Institute of Medical Sciences and Research, whose dedication today has made this day possible. The collective wisdom of this scientific symposium at our institute in the presence of these luminaries reflects, in essence, more than 1 billion genomes of wisdom today. The Human Genome Project was the first great triumph of the information age. It has given us the book of life, and now it is time we must learn to read it. These were the profound words from Dr. Francis Collins, the former director of the National Human Genome Research Institute, and this sets stage for our purpose today in the Scientific Symposium. On this auspicious occasion of Navratri Eve, where we celebrate the divine feminine power or the Shakti, the source of all creation, energy, and innovation, it is not merely a divine coincidence that we are embarking on the Scientific Symposium, which is also encouraging us to go back to our roots and study the purpose of genomics. Today, what we may take as a baby step for our institution in the direction of genomics and immunotherapy is going to set a stage for a large genomics program at our institute. A vision of this magnitude could only be realized through collaboration and collective wisdom. We are honored by the collective genius in this auditorium today, and we have to acknowledge Mr. J.P. Madi sir, the director of the Bangalore Pharmaceutical and Research Laboratory, who by Sadhguru's grace was instrumental in helping to string together the following luminaries. Our heartfelt appreciation and very warm welcome goes to the international pioneers in immunotherapy, some who have traveled from United States of America, Canada, such as Dr. Sachdev Sidhu, a leading figure in protein engineering and synthetic biology, Dr. Shane, an expert in advanced therapeutic antibody formats, Dr. Ron Goyer, a founding force in biological therapeutics and molecular diagnostics. We're equally privileged to host distinguished clinical and research experts, including Dr. Sabrinath, a pioneer in CAR T-cell therapy, Dr. Satish Chandran, who brings in decades of experience from biotech startups to pharmaceutical giants like Pfizer, Dr. C.S. Mani, a distinguished surgical oncologist with over 3 decades of experience, Dr. Raju, Dr. Parthasarthi Reddy, who are advisors and stalwarts in the space of genomics. A special note of welcome to our esteemed guests from the Government of Karnataka, Department of Biotech, Dr. Mohammad Adil, the Managing Director of Bangalore Bio Innovation Center, Professor Sundar, a leading expert from IIT Delhi in bioinformatics, and Dr. Painiyappan, the CEO of Aridica from USA. All of your presence and partnership are invaluable today to us. We are united in purpose. We are filled with gratitude, and we look forward to Sadhguru's guidance and vision for this symposium, which is a foundation stone for a revolutionary approach of healthcare that will redefine how we understand and decode the human being. Sadhguru's commitment to genomics has been absolute. His selfless and relentless drive to bring the most advanced treatment to the poorest of the poor has led to meetings even at institutes of eminence in the US, such as Stanford School of Medicine, and also with the former chief medical officer of Harvard Medical School, Dr. Bikash Verma. Sadhguru has consistently emphasized the urgent need to bring down the prohibitive costs of treatments such as CAR T-cell immunotherapy. His recent visits earlier this year to premier institutes such as the Indian Institute of Science and IIT Madras Research Park, where he's driving to the forefront, breaking down barriers of cost and advancing technology like never before, is setting the tone and context for this mission of bringing accessible, affordable, and available healthcare to one and all without discrimination. I must mention that under Sadhguru's vision, we are also embarking with a company, Pranic AI, where the goal is to provide a base for the genomic study through 1 million healthcare screenings at our own institute, Sri Madhusudan Sai Institute of Medical Sciences and Research. I'm also very happy to inform that we are on the verge of establishing a state-of-art research, translation research facility here at our hospital, which is poised to make significant contributions to the genomics projects and initiatives across the world, including the ones at India. This lab is envisioned to be a cutting-edge research center strategically located here in Bangalore and partnering with some of the best. We are also working on establishing research facilities for rare diseases such as rheumatic heart disease in the upcoming free homographed heart wall bank, which is named after the great pediatric surgeon, Dr. K.M. Cherian. And it is our hope that this mission will pioneer next generation solution and give a hope for understanding the underlying causes of diseases and developing immunotherapies. Today's journey is designed to spark that very collaboration. Our program today will take us from inaugural keynotes by Sadhguru, various panel discussions, keynote talks around antibody engineering, as well as how AI is revolutionizing genomic medicine. We hope that this will bridge the discovery and application for laying the foundation of next generation sequencing for translational medicine, translating scientific theory into life-saving therapies. In conclusion, I would like to recall the profound words of our former president and great researcher cum scientist, Dr. APJ Abdul Kalam, who taught us that dreams are the things that do not let you sleep. They are not the things which you see at sleep. We started with a dream. We started with a hope under the blessings and vision of Sadhguru Sri Madhusudan Sai when we envisioned this conference and the upcoming Genomics Center. And I would like to end by recalling the words of Google CEO Sundar Pichai, who said, "Artificial intelligence is probably the most important thing humanity has worked in recent times, and I think more profound than what electricity is. Yet I would like to add, it is the power of not artificial intelligence in replacing human intellect, but it is artificial intelligence in augmenting human intelligence with compassion and ingenuity." May the symposium ignite more collaborations, inspire breakthrough discoveries, and ultimately fulfill Sadhguru's shared vision of a more healthier, more equitable, more accessible healthcare for one and all. Sairam, and thank you.
Thank you, Dr. Karthik, for succinctly setting the context of the symposium. We request Dr. C.N. Ramchand to make the introductory remarks. With over 25 years of experience in drug discovery, nanotechnology, and nutraceuticals, he is today a prominent figure in the biotechnology and pharmaceutical industries. He is a co-founder and chief scientific officer of Mac Genome Labs Private Limited, which develops patented products for DNA, RNA, and protein extraction using nanotechnology. Dr. Ramchand also serves as the president and CEO of Saxon Life Sciences Private Limited, a biotech startup focused on novel biologics. His extensive career includes leadership positions at Kemin Pharma and Sun Pharmaceuticals, where he was instrumental in establishing a new drug discovery center. With a PhD in biochemistry, Dr. Ramchand has authored over 70 peer-reviewed papers, edited multiple books, and holds numerous patents. Dr. Ramchand, please.
Good morning, and thank you very much for the introduction. Most respected Sadhguru Madhusudan Sai Ji, who is the leader, head of one family, one nation, and as well as the founder and CEO of various humanitarian work, including all what you are seeing, the medical college, and various facilities. And in fact, I met him about 2 months back first, and I was so amazed to see the things what they are doing. Thank you very much. Thank you very much for organizing this. I'm extremely thankful to Professor T. Ramasamy, and the first person immediately after discussing with Sadhguru Ji is that I called Professor Ramasamy, and unfortunately he has already made his plans for a few other things, and he was supposed to be there today evening at one of the North Indian cities, and immediately anyway he changed the ticket and he has agreed to come. And thank you, Professor Ramasamy. Professor Ramasamy is Padma Bhushan and secretary to Department of Science and Technology, which controls the whole science of India, as well as he is also advisor to the Prime Minister and many advisory. But with all these things, you know, he has kindly consented to come over here. Thank you very much. And Dr. Ayyappan, I thought that, you know, he would be he's not a scientist, he's an engineering background, but then he has also set up a next generation sequencing facility now. I thought he will be a right person to talk for 5-7 minutes about his experience. The reason is that a small company called HLL, Hindustan Latex Limited, made to a very big company over the years. So I thought that his expertise will be great. And my colleagues and Professor Narasimha Rao, thank you very much for your presence. And my colleagues who has come from Canada. So we have been collaborating for quite some time. And many of the molecules have gone into final stages of clinical trial, or many of the molecules are in the market. And one of the greatest scientists is Professor Sathya Sidhu. He has multiple companies, and currently 8 molecules are on clinical trial, all next generation immunotherapy. 2 of his molecules I have developed for macular degeneration, diabetic retinopathy, and he is sitting over there. Thank you, Professor Sathya Sidhu. We also have Dr. Shane. He's an immunologist, biochemist, and a scientist and a professor. Thank you for coming. And Dr. Ron, who is actually an immunologist plus also a biochemist and involved in many diagnostics methodology. And we are actually setting up a company in Cochin, which probably many of these diagnostics can be done much easier. And thank you, Dr. Mani, for my invitation. I know he's a very, very busy doctor, oncologist. And he has agreed that I met him, I contacted a few days back only, and immediately has agreed to come. Thank you, all my other colleagues, Raju Rees, and all the other people who has come. So my today's job is that, introduce the theme of the symposium. Theme of the symposium, what it is written is that genomics and immunotherapy, or we can go one step ahead, called next generation immunotherapy and next generation sequencing. So I'll just briefly tell about that and how this has come up. Next generation sequencing and next generation immunotherapy. Actually, as I mentioned 2 months back through Mr. Maddy, and I think the whole, whatever you are seeing here, whatever is going to happen, the first responsible person is Mr. Jayaprakash Maddy, who is the chairman of BPRL. And I've been collaborating for some of the product development for him. And he told me that I should come and meet with Sadhguruji. And immediately he has arranged. I came over here, and it was so impressive. And when I discussed, almost 2 hours I discussed with Sadhguruji. And one thing I remembered at that time when I was talking to him was Dilip Sanghvi, who is the chairman and managing director of Sun Pharmaceutical. I was reporting to him. Qualification-wise, he was BCom. But I realized that, I have never ever seen such a visionary. That's why from 10,000 rupees, he made a $80 billion company, one of the largest pharmaceutical company. I was reporting to him. And, his thought process is amazing. And I felt the same thing when I met Sadhguruji. He was talking about next generation. So he was talking about next generation sequencing and what is the requirement. What he wanted is that, can this diagnostic procedure can be simplified and can be done very easily for all the patients? Because right now it is not possible for very poor patients because it's quite expensive. The second thing is that immunotherapy, Dr. Mani will tell probably in his talk, so expensive, various immunotherapy, which is mainly for oncology and various applications, various things are there, is very, very expensive. An example, what we have developed, that macular degeneration and diabetic retinopathy, it started with about $20,000 for one injection. Of course, now it is about $2,000, but if somebody has to be injected for 8 months or 12 months, it will cost about, in India right now, $20,000-$30,000. So basically, he was telling that how we can reduce. Certainly, we can reduce if we come out with this molecule once after clinical. It is going to cost nothing more than $2 or $3. So that is the cost difference, whether it is sequencing or immunotherapy. So that was his vision, and what he wanted is that how this can be affordable. And during my discussion with Dr. Sathya Sidhu, he has developed a molecule which is called respiratory syncytial virus antibody, which is for RSV, which is normally affecting small children and elderly population, and the mortality is very high. So he's very happy to collaborate and develop for the Indian application, and probably we might have a 10 minutes discussion and we can take it further on this molecule. So this is the way collaborations actually happen. Suddenly when he came here, when we discussed, he was very happy to discuss and take it to the next stage. Anyway, now what I will tell is that, how this immunotherapy and next generation sequencing has come. You all know about drug discovery process. And probably it has started about 100 years back with aspirin. And subsequently about 40, 50, 60 years back, molecules started coming. And there is two different types of molecule, NC or small molecule. And the other one is called large molecule, protein molecule, or antibodies, what we are talking about. So most of the drugs till date developed, about 500 such molecules only has developed for a disease of 36,000. That is the thing, 36,000 diseases, we have only 500 different molecules, and there is something called Me Too drugs, like, analogs of this one, probably about 2,000 drugs, and hundreds and thousands of formulations are there. That is altogether different. Anyway, now what has happened, this small molecule development is very complex. It is not such simple. It costs $2 billion to develop, and it takes about 15 years. Now, please remember, India has not developed any drug. In this background, and it is realized last 10 years, this number of molecules are significantly going down. So that is the time that people are thinking about biologics. Now, what is biologics? The first molecule, whatever I told, is a small molecule like aspirin or, brufen, those type of molecule. And that is normally taken orally. The second part is protein molecule, which is large molecule, which can't be taken orally. It has to be injected, and that is needed to be given in very small quantity. And this comes under biologics therapy or immunotherapy. And what is the start of this immunotherapy? If you remember, the start was by Louis Pasteur, probably 100 or 100 plus years back, maybe 200 years, I don't know, 18th century or something, that, he has developed attenuated vaccine. That means what he has done is that, for rabies vaccine, it is a virus, so inject it into rabies and take the spinal cord, proliferate it. That means the virus will proliferate, but its effect will not be there. That is what he has done. And such a pioneering work he has done probably about 150 years. And that is based on some of the work even now, what is going on. This thing. Now, subsequently this, so one of the major reasons I told about the classical drug discovery, there is a lot of deficiencies are there. And what I understand is that, please remember, India has not developed any drug. Only 7 countries in the world could develop drug till date. And there is no single drug from India which is about $1 billion. So in this background only that we have to do such massive, complex work, and which can, if there is like a scientist like Dr. Sachdev and his team, it is possible to do. Because we have done a molecule development, 2 molecules for macular degeneration, diabetic retinopathy, which is far superior than the existing one in 5-year time. Now it has to get into a clinical evaluation. So it is a doable thing. If scientists come together and work together, it is possible to do. Now, let's see the emergence of biologics and immunotherapy. Now, the earliest biologics are your own body's biologics. For example, erythropoietin. Or you can also see some of the therapies that, blood transfusion, that is a kind of therapy, or kind of protein therapy, which the plasma proteins will be taken and injected back. That was some kind of earlier. Then later, recombinant DNA technology has come, and people know how to make erythropoietin, interferon alpha, interferon gamma, and one of the earliest was insulin. Insulin originally was taken from animals. Now it is by recombinant human insulin. Exactly what you are making, the same thing can be made using recombinant DNA technology, and that also has significant improvements are there. So this is the first part. After that, immunotherapy, mainly connected to vaccine. So various vaccines are there. Live attenuated vaccine, which that, the live vaccine, live virus, live bacteria, mainly virus, which will be proliferating in the body. But the problem associated with, for example, the secretion of some toxic substance, or the one which causes or goes and binds to a receptor in the body, that will be knocked out. So it will have all the required protein which will produce antibody, and that's a very good vaccine, this thing. Inactivated vaccines. What you do is that, the easiest way to do development of a vaccine, take the virus, kill the virus, inject back. So easy. Everyone asks one question that drug discovery takes 15 years time, but on the other hand, we developed vaccine, various types of vaccine during Corona time in 1.5 to 2 years. It is possible. If you really want, it is possible, because the reason is that the complexities of making these vaccines are not as complex as developing molecules. See, subunit vaccines, which is, for example, present in the surface of the bacteria or virus, you take that, the protruding, the protein, and clone it, then that can be injected, that will produce the antibody, it will become a vaccine. Then toxoid vaccine, the toxin will be inactivated. For example, diphtheria vaccines and tetanus toxoid, etc. So that's another way of doing. And conjugate vaccines. Conjugate vaccines are mainly, sometimes many of these bacteria will be having surface, will be having carbohydrates. Carbohydrates as such, if you take and inject, it will not be immunologic. So what you do is that, you pick up that one and link with protein and inject, that will become, that is called conjugate vaccine. mRNA vaccine, all of you know. mRNA vaccine, which during the COVID time, the first time which was introduced, so there is DNA vaccine is there, mRNA vaccine is there. One of the problems, doubts, and fear of the people was that this mRNA which go and, get into your the genomic system and continuously producing these type of this thing. So, yeah. So I do not have much time. So I have a lot of to talk, because I have another 3 or 4 more talks are there. Anyway, so I also wanted to talk about, apart from this, the vaccines and many other antibody therapies, and there is a lot of platform therapies are there. So the idea is that, after our discussion, how this can be developed over here. And the other thing is that next generation sequencing, where how the DNA sequence can be used for diagnostic purpose, precision medicine, etc. So our team will be very, very happy to collaborate with you, and will do whatever is possible to make sure, and next few years, a very good immunotherapy product is coming out, and a next generation sequencing facility. Thank you very much. Thank you.
Thank you, sir. May we now request our chief guest, Dr. Tirumalachari Ramasamy, to address us, please. Former Secretary to the Government of India, he is a distinguished technologist and scientist with over 250 research papers, 50 patents, and 12 process know-hows. His innovations like Allutan and Alcrotan placed India on the global map in leather auxiliaries. During his tenure as Secretary, he launched several landmark programs, significantly reforming India's R&D ecosystem. Padma Bhushan, Professor Ramasamy, please.
Sadhguru, brothers, sisters, fellow human beings, Namaskar, Pranams. Science without humanity is called a social sin by Mahatma Gandhi. Today, we have assembled in this house where the whole world is seen as one family, Vasudhaiva Kudumbakam. Thank you, sir. Thank you, Sadhguru, for this. And I would now, as a generalist, address the value and the cost of the scientific symposium on the next generation genomics and immunotherapy. I think it was, as was introduced, we are all connected, united by the purpose. I think I'm here for that joining the purpose for which this organization has got up together this wonderful scientific symposium. If you want to look at this scientific symposium, as a scientist, I would ask this question: have the benefits of scientific research at the world stage reaching every member of this global family or not? And I will then come back and tell you why we need to have a different generation, next generation methodology for pursuing research itself, not about what research we do. The present grammar of scientific research in the world is built on what I call a competitive excellence. In this competitive excellence, which is highly resource intense, talks about 10 years, 15 years, so many $1 billion. And the total investment of the world in research is estimated at $2.1 trillion. And if you were to invest a similar kind of money as the United States does on research, the world investments would require to be $13.9 trillion. Therefore, what it conveys to you, the present level of R&D investments of the world bypasses 60% of this global family that the association is talking about. Therefore, in the context of next generation, we need to ask in a human healthcare system, why do we need it? What has happened to the last generation process? The current methodology of discovering drugs, finally discovery to delivery process to human systems is not only prolonged time frame, but also cost significant amount of money, to a point that most of the human healthcare system has become primarily a business and less of a service. Therefore, we might have to look at another grammar for this process. Not that we are, as a society, we are starting de novo. There was Ayurveda and Siddha in this country. It was a health as a service. My uncle was a Siddha doctor who will never take any money for any treatment. And because there was an alternate, we call them alternative medicine, traditional medicine. Truly, that is the original medicine. What we have is alternative. These alternative models had been now looked in the framework of what is needed, the purpose of healthcare. If you look at the United States, 18% of the GDP is human healthcare costs. 18% of United States GDP is larger GDP of many parts of the world. Therefore, we need to have a different approach to human healthcare itself. Of course, the modern medicine has helped enormously in dealing with infectious diseases. The life at birth 2 centuries ago used to be 26, 27. It moved up because of antibiotics. Infectious diseases have relied on molecular medicine and the approaches that they have gone through. What happens to non-communicable diseases? What happened to the autoimmune diseases? And there are several diseases that we are talking about today. Man cannot be treated as a mouse. The grammar of Ayurveda and Siddha doesn't treat man as a mouse. The animal studies don't fit. So the grammar of Hindi will not fit the grammar of Tamil. These are the realities. Now, the Ayurvedic and Siddha treatment procedures, as you are aware, empirical, anecdotal. And there's no way of capturing the value of that treatment. Ayurveda as a process treated man as a part of an ecosystem, and therefore the solution and the problems are matched in the same ecosystem. It cannot globalize, so it can't reach the world. Therefore, we need to ask a question in the next generation approaches. What are the objectives we need to have? Now, we need to ask this question, how do we get a personalized medicine? How do we get a precision medicine? Precision medicine at a very high cost is not affordable. So it has to be at a public cost. Therefore, the 3 Ps, essentially personalized, precision, and public. Now, if you want to go in that model, we have to understand the genomics from first principles. And we have to find the particular kind of immunotherapy that is required for the particular patient in this process. You are looking at a completely different set of grammar requirements in this process. And I believe such an opportunity did not exist in earlier times. The reasons were these doctors and patients were one-to-one and empirical, anecdotal, and eventually they were not captured. Today, there's the Indian scientific process, the Vigyan itself, is not based on reductionism. It is based on integration. They look at a comprehensive total systems and together. Therefore, you have to understand the genotype, the phenotype, and the alleles, and look at the triads and how do we connect them. Fortunately, the modern tools of artificial intelligence, machine learning processes, and so on, provide an opportunity to gather the inputs of many, many people across the world and look at those processes and eventually provide some kind of interrelationship. And therefore, we are in a position to look at a possibility of making a personalized medicine public at affordable cost. And that's a question that we have to look at in this process. Therefore, the purpose of this particular scientific symposium is to make such a thing happen. We can't build on the grammar of competitive excellence. Excellence is two ways. You can outperform somebody else, surpass somebody else at a particular time. India's best example is C.V. Raman for the Nobel Prize. Other method of excellence is to outperform yourself perpetually. And the global best example, universal example, Mahatma Gandhi. Therefore, the question that we are talking about today, how do we take this model of from a competitive excellence to collaborative excellence with a resource optimization? That means every one of us participating in this human healthcare process, from drug discovery to delivery, or clinical care to discoverers, both ways. It's not one way, not unidirectional, but biaxial directional processes. If they are to happen, there are methods and tools and techniques available today in the form of, I call it augmented intelligence, not necessarily artificial intelligence. I think man cannot surpass God. What God has given as a native intelligence cannot be surpassed by man. Therefore, it's an augmented intelligence, helps the man to get more out of his own intelligence. And in this context, I'd like to share one or two anecdotes. When I was in the Department of Science and Technology as secretary, there's a lady by name Thelma, who's a professor of genetics in University of Delhi. She came with a proposal to screen newborn babies in the fetuses of the woman, and she wanted to screen 200,000 fetuses. The budget at that time was 300 crores. And I happened to have sanctioned 180 crores from my department and 120 from public process. That had happened about 12, 13 years ago. I'm very happy to report to you today that she actually screened 200 fetuses around Delhi in the last 12 years. And she has been able to correct some 2,500 inbound errors in those families through the immunotherapeutic processes that they have done. This is a real-life story. And I like to acknowledge the contributions of the collaborative exercise that this team did in newborn screening process right here in this country in the last 12 years. I think there's an example for us to follow to the next stage. If you look at this business of, I talked about the model of collaborative excellence and competitive excellence. Let us take this example of COVID vaccine. The vaccine was discovered by Oxford and made in this country, and the cost changed. Fundamentally, human healthcare has to be necessarily taken as a service, not as a business. If that has to happen, all the knowledge streams, not just science and technology alone, I believe all the knowledge streams have to pull together the human endeavor to make this happen. And I have proposed to various policy dimensions how to make this transition from a competitive excellence model of the world research systems costing about $2.1 trillion, and there are only 10 nations which have a possibility of taking care of the systems, to an alternate model of a collaborative excellence, how the world itself can get united in this process. And I won't go into the details of this. I have a flight to catch at 1 o'clock. Therefore, I had to request my friend Ramchand to give me a little time, and I'm very sorry for this process. And I am here as a call of my duty to participate in the scientific symposium, because all of us are connected by the common purpose of making the human healthcare system affordable, accessible, and it's a precision, public, what I call a personalized medicine process. And in this area, genomics and immunotherapy are two strong pillars which will, and verticals that will contribute, but they need more than genomics, much more than immunotherapy. And I believe what is important, we must be connected with this common cause, science for humanity. Thank you very much.
Thank you, sir. We are honored by your presence at the symposium, and we are grateful for you for sharing your valuable insights and wisdom with all of us. We extend a token of our appreciation to Professor T. Ramasamy. Our next speaker is another distinguished leader in the healthcare sector, Dr. Ayyappan. Recognized for his transformative role as a former chairman and managing director of HLL Lifecare Limited, his leadership was instrumental in HLL achieving Mini Ratna status as the company evolved from a contraceptive manufacturer into a global healthcare company with a diverse portfolio. Currently, Dr. Ayyappan is a chairman of Sage Genome, a Kerala-based startup he co-founded that specializes in genome-based technology for personalized healthcare and early disease detection. The company's Oh My Gene platform utilizes saliva samples to analyze genetic information for various health conditions, offering personalized wellness programs. Dr. Ayyappan, please.
Pujya Sadguru Pranam. Distinguished scientists, my good friend Dr. Ramchand, great leaders who have come from Canada, medical students, my greetings and good wishes. As Mr. Ramchand mentioned, by education, I am an engineer and a management graduate. By profession, I have been a corporate executive, and mostly I was dealing with healthcare. After my 40 years of corporate life, I got into setting up of a genomic company, thanks to the inspirational support from Dr. Ramchand. I am really glad and extremely delighted that I am able to take part in this very important one-day international workshop on immunotherapy. This gathering marks not just a convergence of brilliant minds in science and medicine, but also a reformation of our shared vision of a healthier, more compassionate, and more hopeful future of humanity. When we speak of immunotherapy, we speak of a revolution. It is not merely a medical intervention. It is the harnessing of the body's own intelligence, empowering the human body's immune system to fight diseases that once seemed invincible. Cancer, autoimmune conditions, chronic infections, these are not just biological challenges, but human struggles, sufferings of families, and battles of hope. Today, science gives us the courage to dream of victories where once there was only disappointment and end-of-life situations. But what makes this moment truly special is that we are gathered under the larger umbrella of wellness, genomics, and personalized medicine. These three streams, when flowing together, will shape the medicine of tomorrow. Immunotherapy provides strength, wellness ensures prevention, and genomics guides us to tailor treatments, recognizing the unique DNA structure of each and every individual. Together, they form the trinity of next generation healthcare. At this juncture, I would be remiss if I did not acknowledge a visionary who has transformed not just healthcare delivery, but also the spirit with which healthcare is made accessible and affordable to masses. Sadhguru Sri Madhusudan Sai, his initiatives in healthcare, education and nutrition are not just to build institutions, but living examples of selfless service. The Sri Sathya Sai Sanjeevani hospitals, the Sai Sanjeevani Children's Heart Care Centers, and his vision of free, compassionate healthcare for all are redefining the way world is going to see healthcare. In an age where healthcare is often entangled with a business outlook, as Professor Ramaswamy was mentioning, Sadhguru Sri Madhusudan Sai has provided that healing can remain pure, unconditional, affordable, and accessible. Thousands of children with congenital heart diseases, countless families in distress for want of healthcare support, and communities otherwise left behind for dignified life have found hope through Sadhguru's initiatives. This is not merely healthcare, it is care with a heart. Healthcare that remembers that human soul behind the body. What is important in our life is the purpose for which we exist. Sometimes when we do something, we may not know our purpose, but I am sure that the journey of our life, of each and every individual, will ultimately take us to our purpose. Here, Sadhguru's purpose is noble, pure, and divine. In fact, I was amazed to see this facility. I could see the power of vision, the power of dream. The dreams are the power to change the world. That's what I could see in this campus. Actually, how this affordable healthcare reaching out to 1 million people in 100 countries, it is something magical. When I read this slogan, one world, one family, that's the power of bringing the whole world to our mind, to this place. I'm sure each and every person sitting here would have been seeing the whole world in our minds. Sadhguruji, this is the power of the mind, the power of the world. When we talk of the future of immunotherapy, let us remember it is not only about technology, but about humanity. Yes, the trends ahead are extremely challenging. CAR T-cell therapies, cancer vaccines, immune checkpoint inhibitors, AI-driven genomics, and pharmacogenomics guiding personalized medicine. These are the important things which are going to come. But the purpose of all this is singular: to serve life, to protect dignity of people, and ultimately science for wellness. That's what Professor Ramaswamy was mentioning. The healthcare has to be a service. I am sure that this conference, guided by Sadhguru, will pave the way to ensure that each and every child in a remote village in India will have access to, not only in India, the 100 countries or more countries will have access to cutting-edge immunotherapy as in a most advanced hospital. This conference will lead us to a future where science bows to compassion, where wellness is not a privilege but a right, and where genomics ensures that treatments are designed for each individual, reducing their sufferings and increasing wellness. On this day, I felicitate all the scientists, doctors, and visionaries who continue to push the frontiers of medicine. And above all, I offer my deepest gratitude to Sadhguru Sri Madhusudan Sai whose life's work reminds us that science and spirituality, knowledge and compassion can and must work hand in hand. May this workshop ignite new collaborations, inspire bold innovations, and nurture in all of us the spirit to serve humanity selflessly. Let us pledge that the breakthroughs of immunotherapy and genomics will not remain within the walls of laboratories, but will reach the very last patient, the most vulnerable heart, the most distant at home. With these thoughts, I once again extend my heartfelt felicitations and my humble pranams to the noble presence of Sadhguru Sri Madhusudan Sai. I wish I would have met him almost 15, 20 years back when I was running a big corporation. Because there my objective, I have been dealing with condoms, oral contraceptive pills for the large section of people in Uttar Pradesh, Bihar, Orissa and Jharkhand. The basic purpose of the company was to make these products affordable and available to these people, the needy people. Always we talked about science for wellness. That's what Dr. Ramchand was mentioning. We made a small company, a big company. Ultimately, it depends upon the purpose. I'm sure that with great purpose, the pure, unconditional purpose for which Sadhguru is starting this great institution will be a great success, will become a global institution in one of these days. Thank you so much for this opportunity.
Thank you, Dr. Ayyappan, for your kind words. We are grateful to both our speakers for their presence and participation and extend a token of our gratitude to both of them. To Dr. Ayyappan, we extend a token of our love and gratitude. And to Dr. Ramchand. On behalf of everyone, we request Sadhguru for his inaugural message.
As we chanted while lighting the lamp, Asato ma sadgamaya, Tamaso ma jyotirgamaya, Mrutyor ma amrutam gamaya. That is the Indian ethos. We were always seekers of truth. From untruth to truth, from darkness to light, from death to immortality is the prayer. And we as Indians or as human race have always been knowledge seekers. We always wanted to unravel the mysteries of the universe, find the truths behind all that which is untruth in the terms of impermanence, and then find that permanence behind all that is transient. That was always our way of life. Human inquiry, human curiosity is the one which drew us from centuries to reach where we are today as a modern human society. India in particular is especially the very land of knowledge seekers, the rishis, the seekers. And they not just found the truths behind the material world, but even beyond that. The world beyond the material plane also was discovered by them. So our Indian knowledge systems have been very deep in their understanding of here and hereafter. And when on this special occasion we gather to find more answers to some of those unanswered questions in the field of healthcare, and we have such a distinguished chief guest, Professor Ramaswamy, whose lecture was, I think, so profound and insightful, and also so very contextual and appropriate for today's times, giving a background of what healthcare was like and what it should be like, and leading us from competitive excellence to collaborative excellence, so that all fields of knowledge can stream in, work together to provide solutions for the larger human societies. It was a wonderful talk, and I think we are very, very grateful for his presence, though he had a flight to catch, he had to rush. But I'm sure his words would remain with us for a very, very long time, and we are grateful to him for that. With me, Dr. Ayyappan, he said we should have met 15, 20 years earlier. But I told him that the universe is such that we all meet the right people at the right time for the right reasons. There is nothing called late or delayed. So I'm sure there is something in the offing. There is a plan in place by the divine design, and something great will come out of this new meeting and coming together. So we welcome you to this institute and look forward to a lasting partnership. Professor Ramchand, he has been instrumental in organizing this conference. He met me just 2 months ago, thanks to Jayaprakash Madhi, who brought him from BPRL and told that you must meet this man. And he kept on telling me 2-3 times that you must meet this man. I thought that there must be something about him, that is why Mr. Madhi is so particular. And he told me he's a brilliant mind and he has great ideas and he can achieve things. And I think this institute needs somebody like him to come and talk to people here. And then we met Dr. Ramchand, and he was very profound, he was very clear, he was very straightforward in whatever he wanted to convey to me. And with all the experience that he has with him, when we had a good discussion, as he mentioned, the only question I asked him, how can we make these precision immunotherapy and all these next generation genomics affordable to the last, the poorest and the least? Because our hospital sees the poorest of the poor patients. And we do not want to deny them the best of the healthcare services just because it is quite expensive. When I was talking to somebody in the US, they told me that immunotherapy in the US would cost you $500,000. And that not many can afford. Even the people in the US, the very rich also would find it very difficult. Then how will a poor person somewhere in the remote village of, let's say, Bihar or Uttar Pradesh or Odisha or Jharkhand or somewhere far, far away in the tribal hills can ever afford this? And that was the problem, that was the problem statement that we had at hand, that how can we make it really affordable? How can we do things differently? How can we find quicker solutions, faster solutions, and make this happen in quick time? And then all these discussions led to this symposium, and I'm so glad that all of you, very, very distinguished people who are seated off the dais, they are all here to discuss this, and we are united in that purpose, as Dr. Ramasamy said, that we want to make the highest quality precision medicine, personalized care, affordable and available to the last and the least. And I think we are a unique medical institution because we are perhaps the only institution which provides both the clinical work, the healthcare facilities free, and also the medical education free. And whatever we come out of it, it is only to make it available to people. There is no personal agenda behind anything. So that is where I think this kind of an idea can really fructify. And as Professor Ramasamy said, that we should bring all fields, all people together. It needs to be a collaboration. Only then it can happen. It can't be done by one institution or one individual or one industry. It has to be a collaboration, and that is the way our scripture says, Sahana vavtu, sahana bhunaktu, sahaviryam karvavahe. May we work together. May we learn together. May we grow together. That is the idea. So I think this symposium, more than being scientific, is also spiritual in nature because it is trying to emphasize on this idea that we must collaborate and come together to make this vision happen. Sathya Sanjeevani hospitals have been in genomic research for last 8 years, ever since the first research lab was established in our Palwal facility. And Professor Ramasamy did mention Dr. Thelma, who is the advisor to the facility, and she has been continuously working with us, and we are trying to find the reason, the genetic reason for congenital heart diseases. And a lot of work has happened. We have the largest biobank in the world for congenital heart diseases, over 10,000 plus samples that we have collected and are studying. And a lot of work is happening in sequencing and understanding where the problem happens and how can we mitigate it at the fetal level. That work is while it's going on. However, in the recent times, what really caught my attention was the non-communicable diseases, which have grown significantly, and they are going to become a huge healthcare burden for not only our country, but for the entire world. And if that snowballs into a tertiary care emergency, then we know that we cannot afford that emergency in any country. Even the richest countries cannot afford to provide good tertiary care to all the citizens. So the best thing to do is to prevent it from happening, predict it before it happens, and prevent it. That is the idea of genomics. So we want to embark on a large-scale epigenetic study, as you said, genotype, phenotype studies for large Indian population, Asian populations, because not much work has been done on the Asian population. While a lot of work, even the Human Genome Project and everything is more towards the Europe and the West, the Asian side of the world has missed out on that. And I think this is where we are looking at making a difference by understanding our genotypes and finding reasons for the diseases that we suffer from, and how can we mitigate it before it becomes too late. And that would perhaps be the greatest service we can do to humanity in the coming times. And I'm sure with such brilliant minds who are sitting here with so much of collective experience behind them, of so many years of good work, and a wonderful place like this, which is absolutely fertile for an idea like this, which wants to support the entire humanity without any barriers of religion or nationality, geography, or socio-economics. I think this is the place where such a thing can really happen. So my best wishes to the entire team for organizing this symposium. It's a short one, but it is the very first one. It is just the beginning of many good things to come. And we are totally committed to a cause like this. And I would like to see a world, as we pray, Sarve Bhavantu Sukhinaha, Sarve Santu Niramayaha. May all be happy and healthy. But to make it happen, we have to find ways, we have to find solutions, we have to find pathways. And I'm sure this symposium is just the great beginning for a greater end. And these little steps that we take today will pave way for a greater future for all humanity. And whatever we discover here is not just for the people of India or people of Karnataka, it is for the whole world. That is what is the idea of one world, one family. Whatever we invent, whatever we discover, whatever we create, it has to be for the entire humanity. And with that vision, I hope we can walk forward together in this commitment with this purpose. And I once again welcome all the esteemed scientists and dignitaries who have come to this symposium. And once again, I want to thank Professor Ramchand for pulling it all together. And I told him that he is a go-getter, because he just said that many people come to this institution, get very inspired. They say, we want to do this, we want to do that. But once they're back in their workaday life, it's very difficult for them to recommit or reinitiate those things. But he is one who told that he will do it, and all these 2 months they have worked behind the scenes continuously with our team over here, and Kartik, Ramesh and everybody, Jay Prakash, and all of them have put this together. I'm sure this is a great beginning. Starting tomorrow is Navaratri festivities. It's again that significant time of the year when we make a transition. We involve in a lot of these spiritual activities which will lead to greater good of the humanity. And I think this is very significant moment in time where we are coming together for a great cause like this. And I would love to see that if all hospitals around the world, all medical institutions can provide immunotherapy or gene therapy, cell therapy to every patient who needs it. And there is no questions asked, there are no costs involved, there is no questions of affordability. In such a world, we can create a world of equality, fairness, and justice for all. I think as scientists, we would have achieved the very purpose of being scientists. So with these few words, thanking all the people again, I wish them the very best, and I look forward to the proceedings of the day. Thank you very much.
Thank you, Sadhguru. With this, we conclude the inaugural event. We request all delegates, participants and panelists to proceed to the Rajeshwari block of the Medical College. Scientific sessions will take place at the Atay Shaw Hall. We will now break for 10 minutes, after which we shall reconvene for Satyadarpan. Thank you.